Let's bring in Dr. Annalee Baker. She is an assistant professor of emergency medicine and critical care at NYU School of Medicine. So, Dr. Baker, let's pick it up there. You just heard what the Leones said, besides warming all of our hearts. I mean, what needs to be done to help folks like them?
Well, thank you for having me, Joe. That was a wonderful story to hear a success story amid the much more commonly heard stories that I'm hearing from my patients and indeed my own parents, which is that it has been incredibly difficult, especially for older people. My parents are in the generation where they're able to use the internet and able to sort of facilities, able to go through all these different websites and county dependent different guidelines and such. There are so many older people who can't do such a thing. And even, I worry a lot about the homebound people and elderly and in various nursing homes. So it's definitely been a challenge. It's nice to hear that we're starting to improve our processes, but it's still a patchwork across the state and even across the country.
If you could wave a magic wand, is there something you think, one thing that we could at least change that would maybe help more people?
Wow, what an interesting question. If I had my magic wand, I can think of a lot of things that I would do. But one thing I would do would be to standardize the actual process for people to have a central location where they can look for where the vaccine is available and whether they're eligible, and to actually put their name on the list rather than having to access multiple websites, call multiple phone numbers. What I'm hearing from patients all the time is that they're being told mixed information. Sometimes they'll see one thing on the website, and when they call, they're told something completely different. I've even heard patients saying that they were told they could get a vaccine, showing up and then not being able to get one, or the opposite, being told there's no way you're going to get one, and then showing up and in fact being able to get one. And that relates, I think, partly to the extra 6th dose that we found in some of the Pfizer vials. But if I could wave my magic wand, it would be to standardize the process for my patients, for all Americans, to be able to access the information and get clear information about when they'll be able to be vaccinated.
All right, Dr. Baker, thank you so much. Good luck to you and to your family as well.
Thank you. You as well.
All right, excitement is building in Tampa, where the